Jerry agenda, or we're going to have to just do this. We need to, so that kind of strategy. So the questions need to be thought about afterwards. We haven't really been talking about these questions, but that's part of writing once we get the objective done. And I think all the groups have their objective or maybe two. And I think a lot have the strategies, and a lot of people are working on the wordsmithing. We do need to put some time into the questions. Now, these are things that actually can be done outside of a meeting, or you could do it with a meeting within your subgroup. That'd be up to you guys. But I think a lot of times you could assign a couple of people within your committee to probably answer some of these questions. So there is that. What we would like to have accomplished today when we do our breakout is that each group comes back very solid with their objective or two, and, be able to talk about some of the strategies. I'd really like to take, and we've done this already, so we're just kind of moving up. We don't need to repeat, but just kind of moving up with it. And if you think your subgroup is going to have another meeting, if you could maybe plan it while the group is together. If it's not, that is absolutely fine. I know probably one feels that they've got enough going, maybe two, and that, maybe some email homework can be done. But then I'd like us to think about our timeline is to have all of this back to the big Longevity Ready Maryland group, which is MDOA, by November 9th, I believe it is. We are really encouraging everyone to have in writing your plans by next Friday, which would give one more week if there was clarifications or anything like that. In addition to kind of identifying all this other stuff, we do need to kind of think about, is this something that needs to happen in year 1, year 3, year 5? And everyone's going to want to put year 1, but we can't accomplish everything in 1 year. So think about that. Research, collecting data. It'll probably take us a year to get that even going, and then to get it out, and then to get the data. So anything that's around research and data doesn't even start. I mean, that's probably more of a 3-year project, those kind of things. We do anticipate, so after we're kind of finished with this, and again, if there's another meeting and, that all the final writings are back in, I would like to target by next Friday, November 1st. We do have a SAG meeting. Again, SAG meeting is the statewide stakeholders. I think that's on the 11th of November, somewhere around there. And that's when all of the groups will come back. That will be its 4th meeting. We've already been updating them about what we're doing and what we're talking about. And then, these are a lot of stakeholders that are working in other state departments, philanthropy groups, legislative bodies. So they've been kind of keeping up with the progress. And that's when we're really going to give a more in-depth and formal presentation to that particular group. If they kick it back for us to talk about anything, who knows? We may convene another meeting with us. We don't know. I don't anticipate we will or won't. I just don't know. We got to really kind of get things on paper. We got to get to the SAG. We got to kind of see what's going on. But we kind of feel like what will happen after kind of the close of Longevity Ready Maryland, this portion of it, come November 9th, is it probably will be some breakout work groups. Makes sense, right? Again, this is a plan. It's just getting going. It's just getting started. So there's that. Rome wasn't built in a day. We are not going to solve Maryland's problems with older Marylanders by next Friday. So there is that. On the objective, something that we really talked a lot about is making all of our objectives and even strategies SMART goals so that we can measure what we need to do. We had a conversation this week because all of the groups were kind of come up with the same thing. And I've struggled on several of them, which was when I'm putting my objective together, how am I supposed to make it measurable? Because I don't have data yet. And I'm not going to have data by next Friday. So what are we doing here? So we talked with the secretary, and we did talk a lot about, what? I think that was the wrong approach to say that the objective needs to be measurable in a SMART goal. Doesn't mean it doesn't need to be measurable. It may be to increase blah, blah, blah. We just don't need to say increase by 10%. We don't have data increase it. So that's where the data would come in, is where are we at? And we know we need to increase that. So that might be a strategy. So I would say if your objective, or if you are getting into a strategy, is getting caught up in the measure of it, because this is a short period of time. We really didn't have enough time to kind of go and figure out where we're at or who else is doing this. Leave it alone. Use the word increase or decrease, and that's enough, because then that becomes the strategy to determine an appropriate amount to get from here to there. And I think that will help us to stick to what we need to do. And I think we were a little too overzealous on wanting a measurable objective. The objectives actually do need to be more high level, because so many things under the objective are really what is actionable. So if when you're in your work group, you have any question about that, or after today, please just reach out to me and I can help you guys with that. I did kind of send that to the chairs a little bit of our subgroups, that if you're getting caught up on that one, don't worry about it. Don't worry about it. We can just keep moving forward. So there is that. One other thing I would like, so we talked a little way back when, if anybody remembers. I do believe that some of these goals, some of these objectives, some of the strategies are going to lead to legislative asks. Legislative session, for those who are not familiar with it, will obviously start in January. The work's happening right now. Legislative people, Annapolis is starting to get busy again. The governor's put forth his bills. The state departments have put forth bills. MDOA actually is putting forth 2, which we don't usually do, but we are. They're not public yet, or I would certainly share what they are, but we are putting forth some bills. We are very aware of other bills that are coming. Legislators are putting bills together. Philanthropy groups will put things together. I know the Hospital Association is putting together something around guardianship. So the work is kind of happening now around bills that will be proposed. We're not on a timeline that we can propose bills that are Longevity Ready Maryland directives. However, I suppose some of y'all may know about some bills that are being tossed around or talked about that may tie to Longevity Ready Maryland. And if you know of that, call that out in your plan, or let's make sure we're aware of that, because it certainly does not mean that we don't need to address it this year. If we know some things are being talked about already, we're not going to wait until next legislative session or 26 to kind of get started. So we don't want to waste this legislative session to not get some things talked about that are already being talked about under Longevity Ready Maryland. I suspect there will be plenty that after a lot of the Longevity Ready Maryland studies have been done in this, that we'll propose even more. I don't know how you have a 10 or 20 year plan when you're not probably proposing things for years to come. So, there is that. But if you do know of things, please make sure we put it in the plan, or let me know, or whatever, so that MDOA is following it and that we support the right things that might help just keep us going. So I just kind of add that about the legislative session that is coming up. Are there any questions about kind of the directive or objectives or anything like that? Julia, was anything else on our agenda before we just get to the nitty gritty of the work and get into our breakout groups?
Nope. I think you covered everything. Just in terms of how much time, well, let Monica go.
Go ahead.
This was a broader question, because
Yeah.
I saw on the LinkedIn that there was a report about the status of the whole Longevity Ready Maryland, and that you have, different work groups working on it. But then it came down to the work groups are covering a wide range of priority areas under 4 EPIC goals. And employment wasn't one of those EPIC goals. And so I was wondering,
Well, the EPIC goals are, so the EPIC goals are promoting economics.
okay,
So it's the Longevity Ready Maryland, it's health, it's we are promoting economics, and I can't remember what the fourth one is. So under our EPIC goal is our 3 subgroups, which is the 50 plus, the direct work caregiver, and then the family caregiver.
And intergenerational workforce
but
Yeah,
is merged with 50 plus.
economic opportunity wasn't part, they list the 4 EPIC goals. Building age-friendly communities, coordinating systems of care, identifying resources for affordable housing and healthcare, and strengthening support for caregivers. So shouldn't
That's not
promoting,
right. Yeah,
Yeah.
I'd have to read that, Monica, because that's not right. I mean,
yeah, you know,
3 of those are, well, all 4 of those are subcommittees that are going on under EPIC goals. Those are not the 4 EPIC goals.
okay, so I wanted, yeah, that's what I
Okay.
thought.
Maybe.
So that needs, you know, because being a leader in employment, you know, of the 50 plus and
Sure.
that is going to move Maryland forward, you know,
Oh, yeah.
quicker than,
I'll pay
others.
attention to that because that's kind of, I guess maybe it's misworded. So the EPIC goals are
yeah,
forwarding longevity ready Maryland. Ours
Yeah.
is promoting economics. Yes, those kind
Yeah.
of things.
okay.
And that we come under that. I will say you brought up something, Monica, and I want to share this. So it was brought up in our SAG meeting or maybe another meeting that they didn't see within Longevity Ready Maryland anything about elder abuse, and that is obviously is a really big topic and this and that and the other. And so how we explained it is it's not that elder abuse is not a part of Longevity Ready Maryland. You can't talk about getting older without making sure that we're putting in safeguards. But right now there is a very, very active task force that is going on at the direction of the governor that actually has subgroups, guardianship, financial scams, and I can't remember the other 2. I'm on the financial scam one. And it's a very active, it's got a lot of judiciary people in it. It's got a lot of us in it. And so its whole intent was that by, I think, January of 2025, they're going to be giving a report to the governor on their suggestions. So we didn't want to duplicate that effort. We also didn't want to overstep in what they've already been working on.
Mm-hmm.
So one of the strategies in another group, that it wouldn't be ours, but in another group of health and well, or affording, I think it's under the afford longevity. One of their strategies is to follow those recommendations of the elder abuse to assure that the EPIC goal is being reached. So sometimes there are things in the workforce is really big within hours. We're talking about family caregivers. Yes, Mary, we can get that to you. Julia can get that up there. So we can, so it's the workforce. We're talking, and I suspect we're going to be talking for a long time about family caregiver and direct caregiver. We've been talking about direct caregiver from a long time in the work shortage, but now family caregiver is just as important in there, and the 50 plus. So all 3 of our subgroups, I think we'll be talking about, and I think I will see that. The governor, though, right now does have an active workforce group, does not just talk about healthcare, talks about other things. But I suspect one of our suggestions is going to be to continue on, work initiatives in that one. So some of our strategies can be to follow that. I know that in our family caregiving one of our strategies is going to be to follow 2 national initiatives that are going on. One was a national study, and it came out with 4 recommendations for across the country from PHI and NOA. Another one came from Advancing States off of a survey they did in 2022. And actually Congress has all of that. Congress actually gave some money to fund, and that's caregiving. So one of the strategies is going to be to follow those national initiatives, because if something's happening nationally and it's being supported from the federal government, we as a state of Maryland need to follow it and see if it's something we would like to do, if we want to, because it's probably going to come down to suggestion. So a lot of times your strategies can be to follow other initiatives that are going on. So when you kind of said that, Monica, made me think just because something may not be mentioned doesn't mean it's not important and it's out there. So
Okay.
thanks for bringing that up. All right. Well, if there are no other questions, we're going to break out. Julia, do you know how long? Are we going to do it till 2 o'clock?
Yeah. How much time would you like for a report out?
I don't think we need more than, 5-8 minutes per group. So just maybe after 10:10, come back at 10:10, gives us 20 minutes to wrap up.
That sounds good.
And again, I would just say to everyone, try to finalize your objective, get your strategies going. I think if everybody could come out of today with those on paper and maybe some directives on how to answer those 4 questions, even if it's one person maybe taking on that task. And if you're going to have another meeting, you could just let us know at the end that you're going to have another one, and then we'll make sure to get it public and out there on the website. So, all right, if we have no more, we're going to hit breakout, and we will see everybody back at 10 after 2. And we'll see what great things we come up with. So thank you, everybody. Hey, JJ, it looks like maybe some people didn't get in here. I'd have to think there are more people than just us 3. All right.
Here it comes.
Hey, Karen, how are you?
Hanging on.
All right, don't let go.
Okay, is everyone here?
I would have thought there would have been more, but
You said 3 years working on it.
okay. Yeah, I think there'll be a few more in here. Maybe were you okay with working with Teresa after today and maybe getting these written up? Because as I was reading yours, and once we kind of re-changed the directive of not maybe as measurable, that objective, it matched a lot of what you had put in writing a little bit before. So
Yeah, no, I'll definitely try to work. And I just saw your email, Teresa, that you're busy this week. So what I'll do is I'll try and do a little bit more research and kind of just try to wordsmith. I'm not very good at it, to be very honest, but whatever I
together
can.
we do it, and then we throw it into AI, just like Teresa said.
So I'll
Yeah.
just get it to you like something in a better shape by Saturday, and maybe when you have like a little bit more time, you can look into it, and we can definitely get around, get
Before
into
we get off this call, we'll have a date.
Yeah. So
Because I'd like to hit that November 1st deadline. Like
yeah.
everyone else. We don't want to be the last ones turning in our
Yeah.
report.
Yeah.
Do you have the workbook, Ash, with the
Yes.
if I do have that, I could forward it. Okay.
Yes, and Julia just shared the link as well, but I do have it as well. And yeah, I may need like a little bit more help when looking at the organizations, particularly when we're seeing that which organizations we need to get involved for each particular strategy. So, but I'll put whatever I have in, and then definitely give your input and add whatever is necessary.
If you're comfortable using Trello, you and I could create a board and we can work on it throughout the week. Like I just may not be able to meet, but I can maybe give some input off hours, outside of regular hours.
That sounds good. We can do
Okay.
that.
So Karen, I'll kind of share one thing we kind of went back to again after now talking to the secretary, which was kind of the directive of have a larger objective, not, create a training program or have more respite or have more funding. I think those are strategies. So she kind of, as we all talked about, we just have too much to do in too short a period of time to probably come up with something so solid. So I just threw out that one that I sent to Teresa and Mavis just earlier today, but create a center-personed approach to support Maryland family caregivers by creating a unique structure for caregiving resources, both statewide and regional, that strengthens the commitment to all Maryland caregivers. Very broad, high level, big words that government people like to read. But the real comes in after, which is, creating a resource guide, following other national strategies, anything else like that. And I know, Karen, you were very passionate and rightly so of, respite, providing more respite opportunities. But what does that mean? What is that? What does that necessarily look like? I think one of the strategies on the respite needs to be who all provides it. I think that there are other so Department of HS, has some services, who all has services, where could we collaborate, where could we join forces, and where do we need? So I think I agree 100% that the respite needs to be somewhere in the strategy and probably called out even more specifically than just to say resources. I don't want the strategies just to say resources. I want them to say, what resources need to be there. Yeah, it's in an email. It's just, I will.
I don't think I got it.
Well, you didn't. I sent it to Mavis
Oh.
and them.
It sounded good, but my brain got lost about 2/3 of the way through it. And I agree with you. And I think that was the point that I was trying to make, talking about respite, that I think that respite and training, and even if you want to pull in some of the direct caregiver stuff, resource guides, I think those are all strategies. And I really have felt all along that there needs to be a broader, more overreaching something that looks like, in the bucket of better supporting family caregivers. And then all those other things were strategies underneath of it. So I like that.
Right. Yeah. So Mavis just put in what I had written. And we can wordsmith this up. We can shorten it. We can wordsmith it out. Again, Mavis and Teresa, whatever you think. But, and I know that one of our strategies needs to be, so we're going to have to, and we can make this.
Have that listed, what was a recommendation, and now should be called an objective. Change it to what Claudia had suggested, which is to improve data. I was going to say something, improve data collection, but if you could identify, repeat it. So
the objective is to ensure that the state has the ability to track the workforce, collect important data on the workforce, and connect consumers to the workforce.
So in other words, we would remove, we could also, remove the reference to registry in the recommendation or the objective.
I would argue, again, I know there's wide swaths of opinion in this work group. I would say that if we're looking again to what Leslie said is what can we in Maryland do that kind of follows the trends that are national or taps into resources that are federal, because again, there are federal matches to build these platforms. I would argue to keep the registry language, and I hear the concerns against it, but I am saying that if we're being consistent,
those studies very important in our strategies, because they're going to come out with federal guidelines. The John Hancock, no, shoot. I can't think of the philanthropist behind the Advancing Direct States. They already have 150 initiatives that they're putting out that states may want to try. And those are coming with caregiver registries. so that a family could actually go to a website and find someone who had been trained. That's the one, that's already doing the family training. And when the training, I think we kind of got off on the thing, but the training wasn't to train them how to be a caregiver, but it was to train them that they are a caregiver and that the caregiver needs to be more intertwined in the care group, whether or not you're caring for someone who lives in long-term or lives at home. So there's a whole bunch. I won't go over that because those are all in those studies if you read them. But I do know that needs to be one of our studies because those are big things and they're target on. And Maryland's going to need to adopt them. Plus, if we adopt them, we may get some of those funded. And if we adopt them and other states are adopting them, potentially Congress starts to fund more of it. Who knows? That might be a good thing.
How might work, dude?
So I think
I
that needs to be one of the
apologize.
strategies. Yeah.
Leslie, I'm going to invite you to the board. I wrote down, I already created the board. I started listing the surveys that you mentioned. I'm going to try to add links. So I have the one for PHI. I don't have the one for advancing, what do you call that? Advancing something.
Advancing states. Yeah.
Right. But I want to invite you to the board because I'm going to need, if you have any
Okay.
others to include, I want you to include them under
Yep.
surveys and studies.
Yeah. Yeah. We can put that on.
Leslie, I think what you wrote is a great jumping off point. I just didn't know if we had completely walked away from, I see Teresa's talking, but I don't hear her. Okay. Have we completely walked away from a focus on the direct caregiver? Because I think that we could tweak this to include that because speaking from personal experience, here I am with the profession that I have, being in the field for as long as I've been in the field. And I had a really hard time finding direct caregiver support in the way of home health aid, really not even home health aid, just somebody to be a companion for my mom 2 days a week. It was hard. We went through a couple of people, agencies that I thought would be good agencies to work with. And then aides didn't show up, or they were there for 2 weeks and then they jumped to another agency. So I think that if there's a way to incorporate something about the direct caregiver, it gives us a broader goal.
But you mean
And-
like a registry, like to have a direct caregiver registry?
I don't know that it has to be that specific. I just think that it can be a broad brush statement. I was trying to wordsmith something, but
Yeah. Well, they actually
um,
have that. That initiative is in the PHI. The PHI and NOA study, actually one of their 4 suggestions is that states create a direct caregiver registry. And they are talking about it within the direct workforce, but I think it's just as important in our particular caregiver. The Board of Nursing has a registry for anyone who's a certified nursing assistant, but that's all they have. And no one has access to it one way or the other. But you've got 5 states. Now they're all union states. So this is a challenge that was talked about yesterday. Now Maryland is a union friendly state, and whether or not you like unions or not is irrelevant. So the conversation yesterday got off a little bit because a couple of people just don't support unions. They're like, oh, you're going to be creating something that's going to unionize. Well, that's just going down a whole nother road. But Massachusetts, Colorado, Michigan have all created, and Texas did, but Texas has put a pause on it. But they've all started to create a statewide basis of direct caregiver registries where you would have your number out there, what trainings you had. They've created in-home caregiver modules that they could take, how you would get in touch with them, et cetera, et cetera. And they said you had to have a starting point, and they used, here's the problem, they used their ARPA funds to get it all going, and we're all running out of ARPA funds. But yes, Karen, I don't think we've abandoned that. I think that's 100% a strategy that needs to happen. I think it's going to take years for that to come about, but I think it's important.
yeah, I was just trying to figure out. I mean, I know that there's other programs out there working on it, but I don't know that would preclude it necessarily from being included in the objective. And then those things could be listed as supportive strategies. I don't know. I don't know what the thought process is on that.
Well, I think that the secretary is kind of wanting now, because if you get something, if you get a word thrown in like registry into the objective and you don't get respite thrown in, then does respite get eliminated? No. And so that's when we've got to talk. And because we have such a short time, and you don't want an objective that's 6 paragraphs long and we don't have data, like you could say increase, you know, that maybe the objectives are more broad based, but the strategies are the actual tangibles this needs to happen to accomplish. So I don't think by not putting it in the objective doesn't mean the real tangibles are going to be the strategies. What other strategies? I will say that in longevity, in affording longevity. Now, this is another group. This isn't our group, but I was on yesterday. They're really, and I'm hearing this a lot, they're really coming up with navigator positions. And I know we had talked about that too. And here was the discussion that was done, is that whatever years ago, the MVA, which is nobody likes to go to the MVA. You never know what you're doing. You have to wait forever, blah, blah, blah. And so it became a state initiative and it became state law that there would be a navigator in every MVA. That's when you walk in, there's a person that helps you get all your papers together and tells you where to go. Because Maryland just said that is just such a horrible service. It's horrible. You know, a lot of hospitals have navigators, you know, on how to navigate this and that and the other, because it's so overwhelming. So
I'm looking at,
go ahead.
I'm sorry, I'm looking at the list that Ash provided, where she had the 8 strategies, and navigation and coordination is there, respite care, caregiver support group. Did everybody see that?
Well, no, this email just went to us. It was just a suggestion. Yeah.
Yeah, I mean, but they seem to include almost everything that we're talking about. And so,
yeah, well, if everyone agrees on it, there's only a few of us sitting here, but you know, I believe that we do need to look into maybe a navigator approach. And Karen, here's what we talked about is, you know, you guys all have a map, you know, and they have a map even on the other side in DHS. But you know, those positions are so, you know, you could do a 5-minute call, you could do a 45-minute call, and they are in retrospect navigators, but they're navigators to all sorts of things. What if the state adopted, you know, when it came to resources, you know, that every department must have navigators that help Marylanders navigate the current resources that are out there? Yes, we would have to add staff, but what if there's resources already out there? So instead of us saying we need to provide more respite care, or we need to provide more money for respite care, but actually if you had 4 different agencies that could give it to you, but nobody knows, but you've got this one expert. So that was just what was kind of talked about in another LRM, was maybe adopting a strategy of navigators to help caregivers.
I wholeheartedly agree. Because I could give you horror story after horror story about why this is necessary, at least until the state does a better job at removing red tape and improving their systems to get the resources into the hands of those who need it. So until they fix their system, navigation is already happening, but people have to go outside of the state to get that help. They have to hire organizations and nonprofit organizations that help them navigate, because there's no other help available. So I definitely agree navigation is necessary, but I also think they need to fix the system. I don't know if you want to put that as part of one of our strategies, but it is horrible.
Well, fix what system? You can't just say fix the system.
So
What's
I mean,
broken, what do
respite
we
is
want to
the
fix?
area that I more recently had to deal with, and 60 to 90 days or longer for emergency respite is not help. That's not help.
Is this through like senior care program?
for respite for family caregivers.
Yeah, but for what, through what program? Who were you trying to get respite through?
Okay, I don't know what department it is, so let me go take a look.
But that comes,
She's talking about the National Family Caregiver Support Program, and
yes,
you know, and I get what you're saying, Teresa, but it's a bigger picture than that, because there's only so much funding, and that's a problem. And one of the problems that we have often is like finding providers. You know, if
I don't
like-
think it's in that. I think it's the wrong program then, because this is
But I
through-
still think that feeds into it. And I hear what you're saying about navigators, Leslie. The thing that worries me a little bit is in my agency, as an area agency on agency, all of my people know how to navigate people to caregiver resources. They're all aware of what those are. You know, the thing that worries me a little bit is if you start to silo things, then you lose that cross training and knowledge across the entire agency. And also just from experience with the current situation with the dementia navigator thing, we saw what happened with that. I still have a lot of concerns about the way the legislation was written, and the responsibility it gives to area agencies, but also then the funding got cut after we had already implemented, and you were all gracious enough to take that hit at the state level. But the money that we got before we even got the cut was nowhere near enough to do justice to the program marching first. So I think the idea of having maybe not navigators, but cross training, so that, you know, I think it would probably be good if every jurisdiction could decide what works for them. Maybe some jurisdictions would like to have a navigator, and maybe that navigator doesn't live in area agencies, but it seems to make sense that they would. Or that there could be investment made in cross training all of your MAP teams, so that they're, you know, we're doing all this thing, that all the cultural sensitivity issues on ageism. I think there's language and culture around caregiving that we could all use more training on. I just wouldn't want to see it get siloed, and I think it would probably be more cost effective in the long run, because it would be a pretty heavy lift money wise. But I like the way you're thinking, and these strategies are pretty on point, I think, that are listed over in the chat.
yeah, they just got to be a lot more defined. Such as respite, offer temporary relief through respite care programs. Well, that program exists out there. There's National Family Caregiver, there's senior care. So that actually already happens. So there's their adult daycare. Well, we have adult daycares, and in-home care. Again, you can get that through senior care. So that first bullet point doesn't work, or we need to much more elaborate on it. Collaborate with local organizations for affordable and accessible options. I certainly don't disagree with that one. I just don't know what that means. Like in anything we go to the strategy is, how can we define the need to expand respite care services? Don't disagree with it. In fact, completely agree with it. But as a strategy, how do we really define what we need to say to the state of Maryland they need to do when it comes to respite care services?
I mean, really, and this may impact on what Teresa was saying earlier about that long wait for respite. That's probably very much driven by the availability of funding and the availability of providers. You know, I know that it sounds great to say we have a National Family Caregivers Program and that one of the services we can provide is respite. But I know from having recently had to do this, you know, if you have an emergency, like say you are the primary caregiver and that person is completely dependent upon you for meals and showers, and you have to have sudden surgery and you got to be in the hospital and it's got to happen next week. Good luck finding some place that, I mean, the most efficient cost-wise thing is probably going to be an assisted living facility, considering that if your person that you're caring for would be worse, they'd need nursing. So that's not generally what people are looking for. The most cost-effective thing would be assisted living. Well, good luck trying to find that, because local mom and pop assisted living facilities, you know, if they've got a bed, they want to get somebody in it that's going to stay there, and they can't afford just to keep a bed empty for respite. So you're looking at more corporate entities, which costs more. And that puts it out of the reach for people. So
Right.
it's really, if you're going to provide temporary relief and you're going to collaborate with local organizations, you have to have money and you have to have providers.
I was just told this morning it takes 60 days to expect to get a check for emergency respite that's from the Department of Health. And I don't know what program you're referring to, if you can get it sooner, but 60 days is too long for emergency respite. And this they said they didn't mention anything about money, funds, or anything about resources, except that that's the process just to get the check cut after it's been approved. So I'm saying that, yeah, there's an issue there that we may not be able to resolve. Like I think Leslie said it earlier, we're not going to solve the problems in these meetings, but we need to definitely put respite on the table, flesh it out some more, and be more specific. I hear what Leslie's saying, and Ash and I can actually do that, but I just want to be clear that there's a problem there that needs to be addressed.
Well, I do think, you said that you were talking to the Department of Health. I think one of the strategies under respite care services does need to be, one of the actionables does need to be a study and collaboration of all available respite services cross sector, meaning from other agencies, because the Department of Social Services has something, the Department of Health has something.
Yes.
We have something, which is me and Karen. Karen and I are on the same side. There's so many out there. How are you as a caregiver supposed to know who in the heck you
And you have to
call?
fill out the same paperwork over and over and over again.
So I do think that needs to be part of the strategy, is to collaborate respite services across multi-sectors, and with the ease of applying, maybe an easier application. And I don't know if that just goes through MAP or what, but I do think that that's a problem, that people don't know who to call because there's different ones out there. I mean, and while it's capped at 500, I think that needs to be a strategy, is to increase the allowance. I think that has to come. And so that's a different way of saying we need more funding, but I don't know how you don't not say we need more funding. I mean, I just think that's going to have to be it. I think we got to strategize the words of it though. And so it's just to increase the cap allowable. And Karen, it's from you. It's not for income based, right? It's just if you need it, but you can only get 500 period in a rolling 12 months. Is that right?
I think every jurisdiction approaches that somewhat differently. There may not be a cap of 500 if it's something different, like say it's a home repair.
And I'm just talking respite services.
Yeah, generally.
Yeah.
But we also work really closely with our adult protective services team and their respite funds, but they're also serving adults, period, not just seniors.
Well, I think that's part of the respite training or respite strategy, is a collaboration of all of them, which at least I think helps getting it all together. So there's something, Teresa, one place, if there's potentially a one-stop shop. I don't know if that we could ever get there, but pie in the sky is not a terrible thing when we're talking about this. And this might be the 3-year plan. Like it might take us 3 years to get there, but I think increasing caps amongst anyone, I know that, Department of DHS, they often have a $500 cap too. I hear social services talk about a 500. Somehow that word has gotten out there. And yes, if you get to it and you need more, you can go, but why? Okay, we're going to have to go to 1,000. You can't get anything for $500 anymore. And that doesn't mean serve less people. It means increase the cap for all the people you're doing. And we are putting together, actually, I got to do it by this Friday, of everyone who is receiving senior care services. So I know that the state's kind of looking at that. So there's that, but I do think all of that goes into it.
I agree. Well, I've been making notes based on what you said on the Trello board. So Ash and I will have that in front of us when we start to write.
Leslie, is there one of the strategies that's there that you think is pretty close to the refinement you think we need to reach, just so we have a sample, like there's a sample for everybody to think off of?
Mm-mm.
No?
They're not quite there. I could send you 3 if you wanted, or I can put something that we did for LTSS, which was very wordsmithy and really good. That if you kind of wanted a guide, I'd be glad to send y'all what we kind of created. I just happened because Izzy is out of the country, so I kind of took over one of her subgroups with LTSS, and so we've just done some work on kind of defining it more. I think one of the strategies also needs to be to continue to follow and support Senate Bill 202. And I don't know that you have to say much more than that, because Senate Bill 202 was here. It did pass. It was non-funded. I think we could add in, research, family caregiver tax credits. I think all of that could be lumped in for a strategy. But I think this is a strategy to help get dollars into the hands of our caregivers. And I think it's going to take a while, but I know that that's going to be proposed again. So I think it's smart for us to add it into Longevity Ready Maryland as a strategy to support families, as they need to either fund Senate Bill 202, and I think it should be continue on evaluating family caregiver tax credits. So there are other states that have tax credits, if you're a caregiver, and with money back in your pocket come tax time.
So the strategies that were listed on the work group recommendation handout that we got, is that more?
Yep.
Yeah.
That's more of a guideline. Exactly. Yep.
Yeah, and Teresa, I totally believe what you're saying about DSS, because, trying to get payment processed through a state agency, government agencies are not exactly very limber at getting payment to people. So,
And there's no reason why they can't be. It's more, I have tools in my business that I use every day that can make them probably 100 times more efficient, get resources in the hands of people who desperately need it.
the way that
And
we
make their
work,
lives easier.
the way that we work around that is that we have standing contracts with community providers, and so we allow people to choose from those providers. Like with senior care, we have a network of providers, and people can choose, and we utilize those same providers for respite and caregiver support. So that really does help us pivot a lot more quickly. It's just very, very, the government is reticent to make payment to individuals.
I've rarely met anyone that was a caregiver, one that even knew they were a caregiver, and certainly did not know that your offices exist. They don't know anything about the family caregiver support programs. I'm usually the first person to tell them that they exist.
I think you could add that to a strategy, and again, I'm kind of keep going on, but I think we can add, and if it's its own strategy, it's fine, and if it's not, it could be wordsmithed in somewhere. But I think awareness has to continue on. I think we have to continue to have awareness around national family caregiver programs, services, identifications, economic importance, and I think we could put this in, but I think we're going to be doing this with the caregiver grant, and this would just support it. But, we have, finally DHS did a survey on caregivers for 18 and over, but we actually need to caregive 17 and under, because then you're going to be capturing grandparents. So I think that's going to come in years to come. But, I think we continuously have to have awareness on caregiving. We're just going to talk about it all the time. And so how do we talk about it? And just having a month of caregiving, which is very good, don't get me wrong, but it's not enough. But you got to get out and, constantly be making people aware of, are you even a caregiver? What does that mean? What's available to you? Employers, what does that mean when you have half of your employees are caregivers? What does that mean? You need to be aware that you even have caregivers in your in your labor force, because they're the ones that are going to have to call out and you're going to be down. So you need to have flexibility and this and that and the other. That's just a whole nother way of making people aware of caregiving and how huge it is.
Right. And I'm actually on, this is one of my missions for next year, to work with corporations to make sure they understand, one, that there are resources available. I want to help their staff or their employees understand that there are resources available, but how to work with your employer so that you can keep your job and continue to care for your family without losing your mind. So there's a lot of work that has to
NHI,
happen.
well, NHI coming from the 22 national strategy to support caregivers, they picked that up. And they actually have had they're doing a quarter campaign to provide resources and one-stop shops to their employees, because they're one of the largest employees in this area, of, are you a caregiver? You don't have to tell us, but if you are, here's resources. Here's resources we offer you. Here's resources within your counties. And it's anything from telling them when, that Montgomery County has a caregiver seminar, on the 16th of November. It's anything from that to, what family medical leave means and that they would qualify under those particular things. There's not paid yet to what they do. So NHI took a huge step in trying to say, we know we have an employee force that are caregivers and we want to work together. That's very commendable. Yeah.
Yeah, it definitely is, because all I ever received was reluctantly an FMLA form. They didn't want it. Nobody wants to have to give you an FMLA. They had no idea what it was. I mean, they could tell you 12 weeks unpaid leave, but they didn't want you to take 12 weeks away from work. It's not supported at all. Well, I'm going to have to end early, but there are 10 more minutes in this room. I'm going to schedule with Ash outside of this meeting to get together with her next week. The Trail Award is updated with every idea that was shared here.
Okay.
And one thing I don't know if we are firm on the objective. So you might want to consider that a little bit more.
Okay.
Are you firm on the objective? I know we need to wordsmith a little bit more, but if we're close, if we're 90% close, then I know we're not going to do too much to it.
Okay. We'll talk about that. Okay.
Thank you, everyone.
Great. Thank you for coming.
I think to go back to what Teresa just said, we haven't done it since COVID. We used to offer caregiver trainings and like Office on Aging orientation sessions at some of our larger employees and also for our fellow county government employees. We also had connected it to retirees, so that when we did a little work session when we had county employees that were retiring, and we talked about Medicare benefits and senior centers and all the things just to sort of connect them. But attendance is horrible because people aren't interested in taking time out until there's a crisis, and then when there's a crisis, it's usually at 2 a.m. on a Saturday. Or at midnight on a Wednesday, and they're so overwhelmed. It's the worst possible time to be looking for help. And it's just like, the same thing. Like, do you ever have a plumber that you're connected with until you have a crisis, and then you find the plumber, and if he's good, you keep him? Or, that's just human nature. We don't think about the problem until we have to be confronted with it. And that made me think about the construct of the MAP website, Leslie, because the whole context behind that MAP website when it was created was to be that resource that somebody could go to in the middle of the night. And
It's funny when you said it, I was thinking 211, like, yeah.
So, and that just, Ash, so that website is searchable by zip code and by topic. So people can go in, and 211 refers to it, is connected. It used to be that our state office had somebody that kind of managed it and they were the referral source, but you can go in any time of day or night and you can put in your zip code and what topic you're interested in, and it will tell you what the resources are in your community. And some of them might be local, and some might be the Alzheimer's Association. But maybe really fleshing out, maybe that would be a real measurable goal, that to set a time frame and say by 2027 to enhance the resources for caregivers in the Maryland Access Point website, to incorporate all respite resource, just something like it really could be fleshed out more. And it would not, the structure is already there. So I
I like that a lot.
Aren't going to come to a training. They're just not going to come. And they're until they have to know, until they're confronted with the need to figure it out. It's just like, you go through a family crisis and you find out you've got a substance abuse issue in your midst. There's tons of things that happen in the community all the time informationally, but until you have to find a treatment provider or you have to find AA meetings, you're not going to look for that. So I think that if there is something when the crisis hits in the middle of the night that nobody's going to answer the phone at the Area Agency on Aging until 8 a.m. on Monday, but at least you are empowered with that's where you're going to call on Monday. And maybe these are 2 other places you're going to call on Monday.
And 211 is answered at any time. Is that right, Karen? Or do they leave messages?
Mm-hmm.
And isn't that where potentially your navigator specialist could be around all of this? Or that's what they're supposed to be doing anyway, right?
I don't like that.
Okay. Why not?
Because what 211 does is refer them to us. I mean, they're basically playing traffic cop, and it bounces to us anyway. And they don't live in the area agency and have the connections and knowledge that we know. So what they're really doing is saying, oh, you have a caregiving concern for an elderly parent, you're going to call the Office on Aging. Here's their phone number.
Well, is there a way to direct that to that's not their outcome, to just give another phone number, but actually is there a way?
I think what happens there, I'll give you an example. Recently, I was working with the town of Bel Air, and they're working on some senior focused objectives. They're a block and a half away from my office. And one of the committee members was really bent on the idea that the town needed its own senior triage person, basically, that will receive the phone calls. I'm a block and a half away, and that person's going to get that phone call, then refer that phone call to me because I'm the one that has the resources. Meanwhile, that person's lost time, precious time. They get that phone call on a Friday afternoon, and the Bel Air person doesn't get it to us until 5:15, and we're already gone for the day. And then it's 8 o'clock on Monday before we see it, where that person could have called here directly and spoken to somebody on Friday afternoon.
Right. But is that not potentially a strategy to do that back? And let me just say on this one, I am very cognitive, and I have said this in every meeting, Karen, is that we have to pick through these strategies, because if these strategies at the end of the day add 15 tasks to every AAA, first off, y'all were going to kill us. And I said, it can't happen. It can't happen, guys, because then we just take the responsibility. It can't happen. They're already at maximum capacity. So I'm 100% very cognizant of that, of what you just said. Like, I don't want these to come out. We've been batting 211 around. It's under Amanda DeStefano's, but we've been batting it around on, do we take it over? It's privatized, I think, right? Or it's under a nonprofit. So it should be better off. Maybe we send all map through 211 but staff it up or educate it better. I don't know, but
it started with the Office on Aging, the map coordination that all live with the Office on Aging, and the map website was built by Maryland Department of Aging, and it was staffed, and so there were updates that had to happen, and we sent that to MDOA, and then the decision was made it was too much to maintain, it wasn't broad enough, and that's how it got to 211.
Right.
So that was sort of the history of how that happened.
Well, I do. Yeah,
I hear what you're saying, and I appreciate it, but I also just really truly think that a very hearty web-based searchable tool. Like if we could really focus on beefing up the map site, if MDOA could get a staff person who could spend a year or 6 months really refining, because that doesn't even have to so much involve the area agencies. You know, we all know what we have, but
Yep.
you know, does it, take a hard look at it, does it connect adequately to Alzheimer's Association? Does it connect adequately to who you would, you know, who do you call if you think somebody's financially exploiting your loved one? Where do you begin with that? If you need legal documents, you know, like all of a sudden you realize, crap, I don't have a POA for mom, and then we really need to get this sorted out. What is guardianship? Like if that website could really get fleshed out and really, I mean, you could ask any area agency on aging, and we can tell you anecdotally exactly the kind of calls that we get, you know,
Right.
and they're going to be very consistent across the board. And then find a way to take that information and translate it into putting those answers on that website. That helps us too, because then that person could go to that website and find out about the Alzheimer's Association and not have to call and go through our triage, which then further delays their access to that service, which is 24 hours a day, 7 days a week.
Right.
So that's pretty tangible. And if you have a good handle on that, that doesn't just have to be available for families. Professionals can utilize that. You know, if you're
Yeah.
a doctor's office and you're trying to figure out what to tell this person who's just been diagnosed with dementia, that's something you could refer to and use yourself to give the person some resources while they're in front of you.
Yeah. I mean, I think all this can go under awareness and access kind of thing. I think all of these are, and I think a lot of this stuff is when something's already in creation but needs to be refined. All right. Group want to go first on how where you ended up and what you're doing? Anybody want to raise their hand? Oh, thank you, Meg. Go ahead. Meg, if you're talking, you're on mute. You're on mute.
I know. There we go. Sorry.
Yeah.
It took me a second to get it off. I'm not good with Google Meet. I don't know it well. So anyway, we actually made some progress, ironed out some issues and discussion, and Chase, please help me out here if I need it, I'm sure I will. We have there is some confusion to me between the template that you sent out yesterday, Leslie, the template another template we have, and the language of whether or not we're supposed to be calling the 2 items either objectives or recommendations. And we just want to make sure we have all the language correct. And then under each of those, so we have 2 of those, and then under one, we have 6 items that I think we would call strategies. And then the other one, we have 4 that I believe we're calling strategy, that should be called strategies. There just comes confusion because some of the language in the template uses that language interchange. It seems to use the language interchangeably, just so you know. So if you can clarify that, that'd be great. But we're pretty far down the road with our recommendations / goals and or objectives. I'm just not exactly sure what we're supposed to be calling it. I would say recommendations or objective, and the strategy items that go underneath each of them. So
Julia, the recommendations and strategies are interchangeable, right?
Yeah, I think recommendations is, I'll have to double check in the actual template in terms of where it's using it, but I think it's the group is recommending objectives and strategies. And so sometimes that's used as a catch-all. But so it sounds like direct care has 2 objectives that they're recommending and 4 to 6 strategies for each that they're using to support those 2, how to achieve those 2 objectives, right?
Yeah, so it's interchangeable.
Yeah.
Objectives and recommendations are.
Okay. Okay, we just want to make sure we have it in the
Yep.
correct
Mhm.
format, so. And then we're meeting, the small group of us are meeting tomorrow to further refine it. We're going to share it with the rest of the work group before we submit. And is the date, you said November 11th, is that the date that they're due?
I don't know. Julia, check me on that one. Somewhere mid,
Well, the
like the 9th of
the
November, or
template you
something
sent
like that.
yesterday says, yeah, sorry. What was that, Chase?
The final recommendations that we want to have everything buttoned up November 15th, but we're trying to back that out a little bit so that we can make sure there's some tweaking that can, the finalizing that can happen.
Yeah. So forget
okay.
what I said about the 9th, but so the 15th is when we officially end all of this and all of the writing
Okay.
is completed. So there was some thought, what some of the groups are doing is to try to have as much of it done by maybe next Friday, which would then give us 15 more days to kind of wordsmith a little bit more, or if we thought we needed another large group meeting, if somebody needed some subgroup meetings, if anything needed to be clarified. I'm totally okay. I think family caregiver, we're going to be ready by next Friday. But family caregiver's been meeting since way before Longevity Ready Maryland started. So is direct workforce, but you also have a huge task. 50 plus, you guys just get started, which is why I know that there is time, and I don't want anyone to feel any more rush than the 15th would give you. That's still a only short period of time away, but yeah. The timeline's fluid though. It's fluid, so don't anyone panic on that one. So, all right, good. So a small group's going to meet tomorrow, and then you're going to kind of keep on working on getting the wordsmithing done and the work packet done. Wonderful. All right. I will just share family caregiver. Teresa had to get off. I don't know, unless maybe you want to do it. I can do it, either one.
You can do it or I can do it, whatever works best. It's okay.
All right. So we came up with a large objective, which is to create a person-centered approach to support Maryland family caregivers by creating a unique structure for caregiving resources, both statewide and regional, that strengthen the commitment to Maryland caregivers. We might throw a couple more big words in there. We might take a couple of big words out. But the reality is we have to support Maryland family caregivers more, and we all know that. So, and it needs to be very centered approached. And when I mean that is all of our strategies needs to be towards the caregiver. And the only reason I say that to anyone that might not make sense. One of the biggest fails that we've had in the past couple of years is anybody that does something for a family caregiver ends up getting directed towards the person who actually receives care. And that's not a bad thing by any stretch, but we really need to make sure that what we're talking about is about the actual caregiver and what's supporting them. So anyway, so that's the goal, or the strategy. The goal, and then a recommendation, whatever we're calling it now, right? I'm getting confused. I'm confusing myself. Of the strategies, and these are just bullet points. One is to follow the 2 national strategies that are in play. One is by Advancing States, and one was by PHI and NOA, who have already put kind of federal strategies out there. Bless you, whoever that was. Second strategy is to create a direct caregiver registry. Lots of states are adopting that. And all states are very in support of it. It is a federally suggested thing to do. So it would take quite a while. So that's going to be kind of a long term. Another strategy is going to kind of collaborate, evaluate, create additional funding and availability for respite services. There are lots of different agencies that provide respite services to caregivers when they need it. We've got an issue of when you have an emergency, it's not available for 60 days. Well, that's too late. We have a cap of, a lot of people do caps of 500. That's not a lot. Different agencies do it. So we need a lot of work around respite services. One of our strategies is to continue to follow and support Senate Bill 202. If anybody doesn't know what that is, if you ask me, I'll let you know. One of the strategies is to create and support a statewide caregiving training care plan approach, which again is another national initiative that is coming out of the PHI study, which has shown a very centered based kind of approach. That one's going to be a lot more long-term. And then the last strategy, which is kind of the biggest one, is awareness of all resources and easier access to identify resources available for caregivers. A lot of that's going to come around. We were very lucky to have Karen in our group. We already have a MAP website that has that. It needs to probably be enhanced to show more resources. We already have a 211, but it doesn't really work the way it could. We have a dementia navigation kind of portal, but that could be married together. But I think just to continue to increase awareness of who is caregivers and the pull that has on the economy. That's aware, making workforces aware, employers that if you've got you have employees that are caregivers, and the more you support them, the better it'll be to caregivers. You're actually a caregiver. You're not just a daughter. To what am I aware of, or even my resources available to me? So that's a really, really big one, but there's a lot of little things that are happening that I think, with over the next 10 years, I can continue to grow. So that is the family caregiver and 7 strategies of what we're going to be working on. Now we got to get the wordsmithing done and kind of more tangible things to talk about, but that's where we went with that one. I don't know, Mavis or Karen, did I miss anything on that? All right.
Sounded good.
All right. So 55 plus, 50 plus. How did your group make out? And who is reporting? Is Kathy still with us? Or Monica, either one of y'all?
Kathy, are you there? I'm happy to, but I'll also offer the mic to Monica if you'd like to. You want to kick us off,
Okay.
then I can add on some others if.
Yeah, that would be great. So we are working with 2 objectives because all the strategies that we have been talking about either fit into those that refer to really increasing the number of age-inclusive employers. And then the other bucket is to address the responsiveness of Maryland's workforce systems towards the older worker. So training, opportunities, all those kinds of things. So we talked about a number of strategies, including looking at different models that exist for veterans and for other underserved or underutilized populations, and seeing if a model like that could work for being age friendly, incentivizing that. We also thought of developing an outreach and marketing campaign to increase the employer's awareness of the business case, because that we have to address the bottom line. Why is it practical as well as profitable to employ older workers and create age-inclusive workplaces? And then Jody brought up the fact that there are a number of age-friendly employers that exist within the state of Maryland. So how do we get them involved or use them in a campaign to say, hey, this works, and then go and implement this kind of age-friendly, inclusive environment with other employers. So Julia was recording a number of these and is going to try to fit them, the strategies, into these 2 buckets. And we're going to refine them and probably have another meeting next week.
That's great. Y'all are really making some progress in a very short period of time. So kudos to you guys. I will say with National Family Caregiver, we are not going to meet again, but Teresa did create a whiteboard that we're going to kind of try to keep wordsmithing all of our stuff with. Since we've got our objective and our strategies, we're just going to try to keep helping each other with the goal that by next Friday, we've got it in the 95 percentile and going to turn it over to LRM. So just so y'all know where we're at with that one. All right. Does anybody have anything else to add or any questions? Anything you're hearing in other groups that you see cross? I do see a lot of cross, and I think that's good. I will say there is going to be a one kind of work group within MDOA where we're going to talk about a lot of these things that cross within strategies so that we might combine strategies. The outcomes might be different, but if it is, I'm just saying to run a survey, maybe we do it, with whatever, but I can see that, potentially, Monica, you talking about their employers. I think that does go with family caregivers also. And that we need to make an awareness kind of campaign that you've got employees that are working that are family caregivers, and you need to have, first off, even know that you have them and what resources are out there. So I think we can start combining some of the strategies too. So I think there'll be a lot of that over the next, several months of what strategies cross that we, don't have to duplicate efforts, but can combine efforts from different angles to with different outcomes, but with to meet the same objective. So that's a whole nother step that's coming about. Kathy, I see you're back on. Monica did a great job. Kind of saying, I don't know if you have any follow-up of anything.
No, I heard she did a great job. I apologize.
Yeah.
Like, you guys disappeared, and I couldn't. I felt like one of those cartoons. Like, I could hear you, but it wouldn't pull back up, and I don't know why. It was very strange. So user error, I'm sure. But no, we hopefully, I think it looks like we're going to meet next Tuesday, the 3rd, or we're going to meet on the 30th. I'm sorry, the 30th, which is Wednesday at 2:30. So work group, if you can be there, that seemed to be the better day for most.
Great. And Meg, did you say you guys are not needing to meet again, but a couple of y'all are going to get together just for writing the plan? Is that what you'd said?
That's correct. Yep.
Okay, good. Let me ask this consensus. Do you want to have a 5th and final meeting closer to the 15th once everyone's got everything wordsmithed out? Would the group like to get back together for maybe a shorter period of time to really present this stuff, or what does anyone think?
I think that's a good idea.
Okay.
I agree. Yeah.
Okay. All right. Well, then I will put something on closer to the 15th, just so we have one more time together. By then we'll have it. We could probably circulate some stuff in writing for you guys to review. And we'll come together one more time. I'm glad to do that. And I just want to say thank you. It's been kind of quick and fast, but just so impressed. I really, my appreciation to everyone for what you're adding and coming to the meeting, and everyone has been so engaged. It's just been absolutely wonderful. So There's lots of people at MDOA that are very jealous of our group because we're very engaged. So I appreciate that. Y'all are making me look good. So thank you for that. All right.
Thank
If
you,
we don't have
Leslie.
anything else, you're welcome. If we don't have anything else, I'll give you 3 minutes back. Everyone have a wonderful Tuesday. Enjoy this beautiful weather before it gets cold again. And we will see each other in a couple of weeks and we'll keep doing the work. And again, thank you. Thanks so much.
Thank you.
Hey guys.
Thanks.